Good. Just as a reminder, the draping, yeah, it's pretty similar to the tea towel, yeah. So the lower towel goes inside the underwear, but again, don't fold it 5 times, yeah. So be kind of moderate. Just one into the underwear. That's it, yeah. Upper one comes into here. Can you take this arm out and tuck this under? Good. And now it should look very much like that. Yeah, all nicely. The bra is it will be easier for me to do it in class. Yeah. And because I do more mobilization, I do ask most of my clients, female clients, to keep the bra. It's just easy. And then when I need it, they open it, so it's not on its way. You can decide in your practice, it doesn't have to be with bra. You can do it, and we do it quite safe without as well. Okay, let's look a little bit about this body elasticity. Just let the body a bit more stretching, a bit more air, a bit more space, a bit more dynamics, fluid movement, relaxing, rather than a long, tight, quite strong stretch. So we're looking to stretch and oscillation. Remember we talked about advanced technique, that a lot of it is, what is advanced? You're taking two simple things and you fuse them together. Yeah? If you saw the movie Ratatouille,
Yeah.
Mm-hmm.
yeah? This little mouse says, oh, this is cheese, and this is and it's yummy, and this is strawberry and it's yummy. But when it's together, it's like, wow. Yeah, so that's advanced technique. Don't think advanced technique is more difficult. The more difficult is to blend these together. So, yeah, oscillation and stretching. Let's see how we do these together. Yeah? Okay, so let's start with the hip, yeah? So come around this way. So what you can do is just nicely oscillate the hip down. So I'm contacting the iliac crest and the sacrum. Just nicely stretch it and create this kind of oscillation with stretching. Sometimes I will hold it longer and look for the breathing. Sometimes I will compress it a little bit. So sometimes I will compress it, so you can do it from here. You can come and compress it. So I almost like fold it. I try to fold the hip onto the ribs. Yeah. So I slack the muscle as much as possible. This hand goes that way, the other hand goes down. And then I look at the elasticity of the ribs and do a bit more like rotation mobilization. Yeah? So one hand on the hip, one hand on the ribs. Move it this way, other way. And then while I'm doing that, my hand is on the rectus spinae, my fingers on the rectus spinae. So nice and nice finger kneading there. Yeah? Okay, a bit more slacking of the muscle. Can you imagine that? Can you imagine in your hands, in your eyes, how I slack it and then how I stretch it? It's creating this pumping effect of the fluid around them inside the muscle.
Like a piece of paper when you go like that and it bends up.
Yeah, it bends, yeah. If you want to do more, then you need to use the leg as a lever. So what you're doing is just stretching the lower leg, the upper leg, and you can do it completely with a towel, and then you're holding it in 3 points. So these 3 points, maybe come around this way, you could see it better. 3 points is really the minimum you need to hold it, okay. So the first point is their leg into your body. The second point is their leg into your arm. And the third point is underneath the knee. Then you can start moving quite freely. Now I feel a little bit of strain. Why? Because my hand is not long enough. Any suggestion?
Bend up a bit.
Sorry? Move up.
A bit.
So I move a little bit up. Yeah? Now it's a lot easier for me. Look what happened to her whole spine. So I take it a little bit down and I have this hand to stretch it. Yeah? And then compress it. And then stretch it. Okay. I observe the breathing. How is it?
Quite slow and relaxed.
Oh, nicely slow. Bring it back. So this is quite about the hip. You can just really play with. Just move it in circle. Or just hold it here and here. And then you can move it in circle.
Same as on the shoulder, isn't it?
Exactly. We did it on the shoulder. Let's think how many muscles attached to this area. Erectus spinae, quadratus lumbarum, latissimus dorsi, abdominal muscles, gluteal, iliotibial band, quads, hamstring. See what happened? It's quite nice. Any way you move almost, it's a junction. And I remember in one of the anatomy book, it shows like a roundabout. It's called the hip roundabout. And you have like exit to this muscle, that muscle, that muscle. Every place you have an exit to a muscle, and it's all attached around the hip. Yeah? So anywhere you move it almost, you can be guaranteed to have some effect. Yeah? Working nicely on the gluteus medius and gluteus maximus together. And then again, elasticity, rebound. I want you to be like Harlem massage, kind of, you know, how they walk, bounce, yeah? Yeah, get the groove and stretch once in a while, and then compress once in a while. It is a dance. It is absolutely a dance between you, the body, and you have to lead it, but not alone. You have to listen, yeah? Good. Should we do just that? Yeah, it's very playful, and don't stop it. Let it go and see how it evolves. Listen to your hand, where the body wants to go, where it doesn't want to go. Okay.